Good afternoon, everybody. First, I want to recognize members of my team who are actually here, so if you would please stand. Leif, Sarah, Lex, and so thank you so much for hanging in there. We actually were able to kind of find out some interesting information and also give some interesting feedback around care ongoing and hospital readmissions and community collaboration. So our aim, when we started this project about 14 months ago or 12 months ago, was to how can we establish safe and effective transitions of care from Regions Hospital to Westside and Open Cities community clinics in order to reduce all-cause, non-elective, 30-day readmission rates of self-pay patients by 5% by December 31st, 2011. And so the reason why that aim came about is because we actually did some collective conversations with people from Westside and Open Cities community clinics around their providers, and one of the things that they emphasized was communication was very important and communication was lacking, and they felt that that probably aided into some of the hospital readmissions for some of the patients that they served. And so that was one of the reasons why we actually decided to focus on those particular clinics. And we looked at some of the self-pay patients in the non-insured patient populations because we felt that they were at an increased risk of hospital readmissions just because they weren't connected to any type of care. So, as you can see, the aim was not met by the work of this group, secondary to the following reasons, and that it was just that the target population that we identified for the mental health patients, they were actually mental health patients. In the mental health department, they were actually already working on a project that revolved around hospital readmissions and care transitioning among those mental health patient populations. And so that led into us feeling that the scope of the work was already outlined and taking place in the mental health department. I think that some of the relationships were built. They were really well in that we were able to go back and have positive feedback from Westside Community Health and also from Open Cities with regards to communication. And so the disparities were not advanced by the scope of this project just because, once we found out that our work was being duplicated by the mental health department, we kind of, didn't want to step on any toes or actually duplicate the work that we actually did. So as far as the sustainability that did come out of the project is that I think that relationships in the community outside of Regions Hospital will be a challenge to sustain, but through purposed and sincere efforts, this can take place, meaning that as an organization and as a group, we actually have to plan and purposefully reach out to those communities that are served by Regions Hospital, and I think that we can achieve that goal by doing other projects. It doesn't necessarily have to be within the scope of EBAN. It could be within the scope of EBAN, but I think that's something that we have to look into. And so when you think about the spread, I think that goes into, as stated previously, as far as more community outreach, that it should be dedicated, it should be purposeful. And that we should, as an organization and as providers, should really work on dispelling the myths associated with some cultural groups in Regions Hospital and the community that we serve. And then also, just to let you know that even though we did not reach our aim with this particular group or with this particular project, one of the opportunities that we had was that actually our work tied in really well with the Lean team. And so we actually had the opportunity to work with the Lean team. I think some of the administrators in the audience may have heard about the Return to Sender Lean team. And so that work that we did actually fed into the work for that particular Lean team. And that was basically looking at improving communication improving communication that Regions Hospital provides among other outside hospitals as far as creating a discharge packet. And so that was one of the things, that was actually one of the positive outcomes that did come out of the group. So we're happy about that. And so information regarding that Lean team, that's forthcoming because I know we're actually going to do a presentation to the Medical Executive Committee coming up in the next month. So that was a good